Welcome to the Elaborate Topics podcast, where we focus on lab-specific strategies for medical laboratory professionals. We're proud to be the healthcare detectives that work behind the scenes to get the results needed to influence medical decisions. Let's grow together and jump right into the lab.
Hello, lab friends. Welcome to another episode of Elaborate Topics. I am your host, Lona Small, and for those who have been listening or haven't been listening, I'm going to tell you a little bit about myself. I'm a clinical lab scientist, a quality assurance specialist, and a lab leadership coach. My passion is to help laboratorians demonstrate their value as an important part of the whole. I coach lab leaders to create a collaborative culture and to empower the next generation of lab leaders. Today, we have a special guest, and it's Carlo Ledesma. I'm going to read a little bit about Carlo. Born and raised in the Philippines, Carlo Ledesma immigrated to the United States armed with a bachelor's degree in medical technology from the University of Santo Tomas in Manila. He went on to become the first individual to receive the ASCP International certification established by the ASCP Board of Certification. He earned a Master of Science in Clinical Lab Science from Rosalind Franklin University of Medicine and Science, North Chicago, Illinois, and is working towards a doctorate in clinical lab science at the University of Kansas Medical Center. Over the years, Mr. Ledesma has worked in a university hospital and reference laboratory and as an educator for laboratory programs. He shares his passion for hematology with students at local high schools through his volunteer work as an ASCP Local Representative. He's been recognized as an ASCP Local Representative of the Year and has served on the ASCP Council of Laboratory Professionals and the Choosing Wisely Advisory Board. Today, he is certified as a specialist in hematology, international medical technologist, and he holds a qualification in lab safety. Currently, Mr. Ledesma is a program director for a medical laboratory technology and phlebotomy program at Rose State College in Miswet City, Oklahoma. He also serves as a resource for regulatory compliance in the laboratory across Oklahoma and Texas. Welcome, Carlo. Good morning.
Hi, Lona.
How are you doing today?
Good morning. Thank you for inviting me. Hello, fellow lab professionals. I'm glad you invited me here and share a little bit of myself with our colleagues in the lab profession.
Okay. So, Carlo, today we're going to talk a little bit about your experience in the program, the Doctorate program of Clinical Lab Scientists. And we want the listeners to hear about this program, to see if there's something that they would want to be part of. Myself, I met Carlo on LinkedIn, actually, and I was impressed with some of the things that he shared. And I was also impressed when he decided that he was going to enter in the program. And since then, I've been following him, and I thought he would be a great guest for this program. So,
Thank you.
So please let the listeners know a little bit about yourself, your journey in the lab profession, and why you decided to pursue a doctorate in clinical lab sciences.
Okay. So I came, as you guys heard from the introduction, I was born and raised in the Philippines, and I came from a family of medical technologists. So the lab world isn't that foreign to me. So I'm a guess, I'm trying to think, the third generation or second generation of medical lab people. So you guys can imagine birthday parties and the conversations we have over Christmas dinner, right? Microbiology, hematology. But yeah, so this was not foreign to me. But initially, we were, as someone born from the Philippines, we're not well off, we're not rich. And really, though, I wasn't really sure if I wanted to go to college or I wanted to go to university. So my uncle, who was a med tech, inspired me to come over to pursue a degree in medical technology. And, I went to the University of Santo Tomas, and no one said college was easy, right? And to me, I thought I was smart in high school, but going to college, it was very, very challenging. But, I strived through it and pursued and finished with a degree in med tech. And right then after, I immigrated to the United States. Then my very first job in the clinical lab was a lab assistant in a microbiology lab. So, while I was reviewing for the boards, I was working as a lab assistant in micro. And then I stumbled, after I got certified, I stumbled upon a job in Oklahoma that's why I moved to Oklahoma. And that was a great experience because I was, 1 year into great experience and also a scary experience for me because I was a night shift tech and I was doing everything. And for someone new to the profession, doing everything was a scary experience, right? And we've all encountered that. And, that first result that you release, you cross your fingers, or the first unit of blood that you've issued, you cross your fingers that nothing happened, right? So I did that for a couple of years. It was a rural hospital. So, and I liked the interaction between the different professions in the hospital. I had some patient contact experience with phlebotomy and honed my skills there. Right then after, I moved to Oklahoma City, where I got to experience and specialize in hematology. It was at the University of Oklahoma Medical Center, and I was working in the core lab. And in the core lab, I got to see a lot of advanced cases, because it's an academic institution. I learned a lot more. I was armed with the basics and skills of a generalist. And at OU, I got my advanced training, should I say, or, specialist training. I did have the opportunity to work there as a special hematology medical technologist or clinical lab scientist, wherein I learned more about leukemia. And I learned more about the hematologic malignancies, the different tests that, what I've learned in school was totally different from what I'm seeing in practice. And that got me so excited because, now I'm seeing all of this right in front of my face, where in school I was just reading about it. So with that experience, and with that also, I was working hand in hand, in close proximity to the hematopoietic progenitor cell lab, or, because of the nomenclature, the HPC lab or the stem cell lab. So I got to see, the patient, the lab test, and the treatment all together. And that really inspired me to specialize in hematology. So, I'm always someone that is thirsty for learning, right? I'm always hungry for learning. So I decided to pursue graduate studies, and the program that fits my interest was the Master of Science in Clinical Lab Science at the Rosalind Franklin University. There I learned more advanced concepts in hematology. I learned more about management skills and, just the advanced practitioner per se that I had an orientation or an overview in my undergrad. So after a couple of years, I finished my master's with clinical lab science, and that opened a lot of doors for me because armed with a master's and experience in hematology, I decided to challenge the specialist exam for ASCP. So I was successful. That was one of the hardest tests I've ever done in my life. Like everyone listening to this, as lab professionals, as we enter that room to take a board exam, it's always nerve-wracking. No matter how many times you've taken or how many board exams you have taken, it's always a nerve-wracking experience. But I passed, and so I armed with a master's degree and with a specialist certification and a MedTech certification, I have been fortunate enough to be offered roles in supervisory position. So I, right then after, I became a lab supervisor for a nonprofit institution, a laboratory, and I was a shift supervisor at first, and then I became a technical supervisor for a reference lab with the Diagnostic Lab of Oklahoma. That opened my mind to a whole different world in clinical laboratory. As students, we were trained of the theory and the sciences. And as med techs, we were practicing all of those things that we learned in theory. And, Ms. Lona, you can add value to this, but, supervisory positions, management roles, and QA, those, it's essentially a whole different world, right? The operations. So I've learned so much from the supervisory role I did that for about 7 years. And it was a whole different world. It was exciting in a different way. It is stressful too. And learned a lot about regulatory stuff, learned about HR rules, learned about resolving issues, client satisfaction, patient satisfaction. So that and my technical background was a great experience. After that, I decided to. There was an opportunity for me to become an educator. Like I said, I've always been hungry for knowledge, but I also wanted to share what I've had, what I've learned, because if no one did that for me, I wouldn't be in the position where I am. So I feel like we need to, hand it off to the next generation. So I was fortunate to be a program director for the medical lab technician program and phlebotomy program at Rose State College in Midwest City. So that since 2015, I have been serving as the program director and instructor for the discipline-specific classes. And that, too, is very different world, yet fulfilling. So I've been fortunate enough to see a lot of students come in and see them successful in their fields that they have chosen. So that basically has summarized my 15 years of experience as a med tech, as a medical lab scientist. During my course of experience, I've also had the fortune to serve as consultants to some of the laboratories and doctors' clinics in Oklahoma and Texas. As you know, there's a need for that consultant level where, doctors' clinics, rural hospitals, our profession is in dire need of personnel and also specialists who can oversee the operations or ensure that quality results are still turned out or are being resulted. I feel as though that we have a role that serves in public health, that as consultants, we need to make sure that results are still of quality. So I did that in my 15 years as a medical laboratory professional. And not that I got bored, but I wanted to learn more, right? I wanted to learn more. I know I don't know everything, but I've also wanted to know more of what I do. I've looked at different programs, and I did start a different doctoral program prior to KU, but that was a whole different world for me. It was a Doctor of Health Science program, but it opened my mind to a whole different thing, a whole different aspect of healthcare, where, my bachelor's was in lab, my master's was in lab, and most of my experience are in the clinical lab for the last 15 years. So I was stuck in my own silo, right? But this program where I was in emphasized a lot about administration and education and the interprofessional communication. So that opened my mind to, that's what you guys do in that area. That's what that's what you guys do in nursing. Okay, cool. So because I was just stuck in my own silo for the longest time, over the last few years, there's been talks in our profession about advanced laboratory practitioners, right? There has been some programs that came up. Right now there are 3 programs, but last year or 2 years ago, KUMC, I saw the communication about that they're offering a Doctor of Clinical Lab Science. And that was my light bulb moment. Well, I'm here in the doctorate program, but this is really what I want, right? This is the terminal degree for the profession that I love, that I have devoted my entire career to this, my entire adult life to this, and professional career to this. So I, without a doubt, I applied to the program. And there was a few of us that applied to the program, and luckily I got accepted. So right now, I am in the Doctor of Clinical Lab Science program at the University of Kansas Medical Center, and also serving as a program director for the medical lab program here in Oklahoma. So that, in a few minutes, summarize my experience as a medical lab professional.
Wow, what a journey. Amazing, amazing. And 15 years of so much value, so much contribution, so much learning. In 15 years, you've actually, you have not wasted any time.
No,
I am really impressed.
We mean business, right?
Exactly. I can see a lot of similarity in your journey and my journey, immigrating here from Jamaica, going back to college here, even though I was a medical technologist there, and even exploring phlebotomy while I was back in school here. I was working as a phlebotomist, and then I found myself, even though I worked as a generalist, I found myself in hematology. It wasn't so much by choice, but I found myself, and I even thought of doing a specialist in hematology. So while I was listening to you, I could see our paths almost like moving together in the same. But you've done a lot in 15 years, and really impressed with your desire to learn, and with your love for the profession, and with the fact that you are not only learning for yourself, but you're giving back. You're helping in high schools, you're teaching, you're working with ASCP to volunteer. It's funny how you also went into quality and teaching, and that's kind of what my goal is, to give back as much as I can in terms of training and empowering other lab leaders. So, really impressive, Carlo.
So, and to add to that, that 15 years of experience, I've always just set goals for myself. I don't know how other lab professionals do it, but I would advise for you guys to do it. That I've always set, like, every year. I do this as like how people have New Year's resolutions. I always have a personal and professional goal that I want to achieve. And usually I set a timeline for that, like, by July, I want to do this. By June, I should have done this certification, or at least have done this, attended this type of seminar. So I do that, set goals for myself, get professionally involved, because, we are lab professionals, and, we always work behind the scenes. But in order for us to be recognized, we need to be upfront and talk about our profession. And, I've connected with our professional organizations, with ASCP, with ASCLS and AMT, and I have been actively involved in those, participating by providing continuing education seminars, attending conferences, and even had the opportunity to go advocate for the lab profession in Washington, D.C. During the legislative days for ASCLS. And that was a great experience, too. I encourage the listeners who are lab professionals to get involved with the professional society, because we our profession is highlighted this year with the testing for the pandemic that we are experiencing right now. And we should, continue to promote our profession. The passion within us to do our tests, to provide quality results, should be translated in promoting our profession. Because, as you look around the lab, we have an aging workforce. But no one will know about the lab unless we promote ourselves.
Amen. Amen.
Amen, right?
Yes. So, I know you kind of touched on it now, but, what are your thoughts regarding, like, these current changes in the healthcare landscape, and how do you see lab medicine adjusting to fill any gaps or addressing any of these changing needs? So,
talking about my experience as within the last 15 years in the medical lab, there's always changes. The medical lab profession in itself is an evolving profession. I kid my students, I jovially say, what I learned 15 years ago is already a different name. The bacteria that I learned in school is now a different name. So it's always going to change. Chemistry instruments is always changing. And as we learn this year, each and every day, things change. The guidelines that we learned last week may change next week. But it's a very dynamic profession, just like healthcare. And there are many changes that evolve or is happening in healthcare that we should adapt as a profession, and we should adapt as professionals as well. What I've learned in the last 15 years, speaking from the lab standpoint, that there is a need for us. There's an extreme shortage of lab professionals, and a lot of the laboratories that I've seen, whether it's a rural hospital, academic institution, a reference lab, doctor's clinic, there is a dire need for lab professionals. And, reimbursement issues, instrument changes, there's a lot of dynamic changes that are happening in the lab profession, or in the lab in healthcare per se. And, different tests as well. And this is why the laboratory needs to adapt to these changes, in my humble opinion, that, with different methodologies of testing, different tests coming up, that, science is evolving continuously. Scientists are active in their research, that they're finding new markers, new tests to better diagnose patients. As you guys have heard, and I will reiterate that my specialty is in hematology, but my passion is in leukemia. So, the diagnosis of cancer is now with molecular methods, or molecular medicine, or molecular diagnostics is up and up, right? And, some clinicians may not be up to date to that. Our oncologists are very, very good at that, but I feel as lab professionals, we know all these changes. We know all these methodologies that, we learn this, and as professionals, we do our continuing education, so we know and are familiar with these. And I feel as clinical lab professionals or medical lab scientists, we need to help educate the clinicians. And an advanced practitioner like a doctor of clinical lab science can be in that position to help educate, like, for example, a molecular test. This is this is the marker that you want to find out, or educate the public. Now that we are seeing all these tests. I don't know if you or the listeners are familiar with Shark Tank. They sometimes I've seen that show, an episode about a clinical lab testing at home. But as someone who is an advanced lab practitioner, we can help educate the people. Is this what you really want to do? Do an at-home test, because there are different factors that could affect results. When you do an at-home test, who's going to interpret those results? So, but to me, we need to also emphasize education, especially in an evolving world of healthcare, that the medical lab professional needs to have an advanced practitioner that could help educate not only clinicians, but also other stakeholders like our patients and the general public, so that the public is aware of their tests and aware of their results. And for the clinician's perspective, are you picking the right test to diagnose this patient? We are in the movement of lab test utilization, to prevent wastage in the lab. So I think it's imperative that we, as lab professionals, need to help educate our clinicians to do that.
Wow. That is amazing, because so many, as you say, things are changing so much, and we have all these different generations right now in the lab.
Right.
We have sometimes people who've been working in the lab since the 60s or the 50s,
right.
And then you have new people just coming in with different perspectives. So you may have some people who say, well, the medical technologist, you have your place. You run the test, the doctor interprets. It's not your place to question or to suggest. Right. And then you have a new group of people who are saying, we need to help the providers. And the new providers are saying, we need your help, because our focus in our training is not lab medicine, and you have the specialty. Can you help us? So you can see this whole change in the whole landscape, but then depending on where you are and the culture of your lab, it can be a bit challenging.
Right, and to add to that, especially in this day and age where people can just log in on their phones and Google something like, oh, this is the right test for me. But that's really not the case. Or look up interpretation of results. I feel as though that as lab professionals, we need to be in the forefront of this and actively provide information. Doctors eventually will have to do the interpretation and translate and supplement it by looking at the clinical side of things or the clinical presentation of the patient. But as clinical lab professionals or medical lab professionals, we have a role to help the public that maybe that's not the right test for you, or maybe I suggest don't look up your results. Ask your clinician, talk to your doctor about your results. What do you call this? There are different legitimate websites encouraged by our professional organizations that lab tests online. It's a great resource. The reference laboratories like, Johns Hopkins, ARUP, and Quest have, information on their website about tests. But, there's also other websites, not legitimate. I'm not saying they're not legitimate, but they may not provide the right information for patients or for the public. So, just by merely directing people to the right resource is already a big plus. That's if lab professionals out there listening, if you could just actively, teach people, like don't look up stuff in the wrong places, direct them to the right places. Even if you don't want to do all the interpretation, they may not understand the sciences behind it. You don't have to explain spectrophotometry. You don't have to explain the effects of lipemia, but you could always tell them, this is what's going on, and this website will explain it better for you in simple words. And if you want some resources, I could talk to your doctor. Always have that. So.
Wow. So there's so many, probably even new roles that our profession can move into.
Right.
So what? Say someone is interested in a doctorate in clinical lab science. What did you need to qualify to get into that DCLS program, and how competitive was it?
So, there are 3 programs right now, and I believe most of them have their own set of admission requirements. When I was looking into applying at KU or looking at the DCLS program, what I for myself did was, did my own due diligence of research, if this is the right program for me. And, I looked up our professional organizations like the ASCLS. The ASCLS has a DCLS toolkit where, it will discuss everything, like what the need, the evidence of need, and what are our roles. I followed Dr. Gonzalez, Brandy from Rutgers, the first DCLS. I follow her on LinkedIn, and I've asked her opinions on how is the DCLS program. I did my own personal search before I applied for the program. So what qualifications did I need? So at the KUMC DCLS website, it lists all the qualifications to apply, but you need to have experience as a lab professional and certification. But I believe there are other letters of recommendation, GRE requirements, but I'll direct them to the KUMC website to apply or look if they are interested, but you need to have experience and certification as a med tech. So that's the biggest point, or a medical lab scientist. I'm sorry, I am old school. I still call myself a med tech. A medical lab scientist. So that, and how competitive is it? There was a process for admission at KU. There was an interview with the program faculty, and it was pretty nerve-wracking for me. Even if as an educator and experienced tech, I saw a competitive group of people in the during the interview process. But currently there's 2 of us that is full-time and 2 part-time, and I think there is a new cohort coming in this fall. So, wow. But yeah, I think the word is getting out there of this role as an advanced lab practitioner for DCLS, because I think the universities, Rutgers, Dr. Brandy has done a great job of promoting the degree, and the University of Texas Medical UTMB has done has turned out DCLS graduates, and KU we are the first cohort for our program. So
Okay. How many universities are you aware of that's doing that at this point?
I think currently there are three universities: the Rutgers University, UTMB in Galveston, and KUMC, that are offering the degree of Doctor in Clinical Lab Science.
Awesome. Great. So how far are you now in the program? Where are you?
So we were accepted last year, so this is our first year. The summer semester is our third semester at KU.
Okay. So just tell us a little bit about some of your experiences and some of the challenges you have, and good or bad.
So good and bad. There's no good and bad. I've always said education, higher education, most especially, is always a blow to your ego, right? Because sometimes you think you know, but you don't really know. But I've always had the mantra that if I know all of this stuff, I wouldn't be here, right? I wouldn't be in this program of study if I already know this. So I'm here as a learner the same way as my classmates are. Like I was telling my cohort at one point that, like even I've been an educator, but, I've always had questions. No one's perfect. That's why I'm here, because I'm learning, right? The main challenge is, I still work a full-time job. So the balance, work, life, and now study. When we are working as lab professionals, our management will always emphasize the work-life balance, right? But now I added another factor: work-life study balance. But that's a juggling act in itself. But if you are curious in getting into this degree or program of study, consider finding time or devoting a time in studying or doing your coursework, because yes, we have had these classes before, and if you've had a master's degree, you've had these classes before. We all are experienced people, but the main part is you are learning a different concept in clinical lab science, and that was my biggest challenge, was creating a different framework in my head, or a different mindset. Because as lab scientists, we always talk about the theory. We always talk about, the results and how we got into the results. But now we are being trained to how to communicate these results, how to communicate this with clinicians, how to communicate with patients or caregivers for that matter. But, that's my main challenge is, getting into a different mind frame, different mindset. Last semester, this last semester, up to now, we took microbiology, and in the last 15 years, I have not done bench work in micro, so that was a whole foreign world for me. That was challenging, but I've always, as an undergrad, I've always been interested with microbiology, parasitology most especially. I was trained in the Philippines, so parasites are there, right? The tropics is a haven for infection, right? But I've always had that passion with micro and parasitology, and that sparked my interest again, right? Like, oh, I remember that. It's like riding a bike. Oh, yeah, let me read to that. But listeners who are in graduate school, and Ms. Lona, I'm sure you've done this, and scientists, period, have done this, that how you get lost into reading, when you're reading a journal, a scientific article, and you found you found an interesting line, and you look at the reference, and you go to that reference, you read that reference, and you go to that. You get lost in the rabbit hole, right? So that's my issue. is like reading, like, oh, whoa, wait, I'm lost. I was just reading for one topic, and now I'm here. It's like watching a YouTube about how to make a dish, and the next thing you know, you're watching a cat go to the moon. But it's organizational skills is emphasized. Personally, that's my challenge. Learning online is also a challenge. Not everyone is an online learner. Not everyone is self-driven to study on their own. But the nice thing about KU for me is the support of faculty. And our cohort, we're a great group, and we talk always. Even if I am in Oklahoma and they're in Kansas or Kansas City, the power of communication. We always, talk over the phone. We Zoom. So I think communication is important, and having a great relationship with your instructors, having great relationships with your cohort is also important. But my take home for the last year that we've had at KU is, we know as lab professionals, and we have a different personality as lab people, because we are a lab people. We're the type A people. We know what we know. but there are things that like I took hematology class, and I have a very great professor, and I thought I knew hematology, but no, I learned a lot more in that semester in hematology. I've learned a whole lot more and opened my mind, like, oh wow, now that I thought I knew a lot about hematology, but now I'm going to learn more. I see it in a different way. Not that it's a punch to me, but like, oh wow, I'm going to learn more. This is exciting, But my advice is that have that mindset that we don't know everything. That's why we're here. That's why we want to have this, because at the end of the day, the goal of this of our professionals or this program of study is to be an advocate for the lab, to function in an advanced capacity, so that when we talk to clinicians, we are confident in what we're talking about. When we talk to a patient, we're not talking in scientific jargon that they will not understand. Like, why am I talking to you? Because you're going to talk to me in scientific jargon again that I will never understand, right? We need to be that role. I've always had it in my mind that we should be patient advocates too, because they're all at a loss. You can imagine, I'm going to draw from experience here. Imagine a cancer patient, a doctor talking about this is JAK2, your JAK2 is this, and your NPM1 is this. They don't know that, but we as lab professionals are familiar with this, and we can have that role to translate it into words that the patient can understand, without interpretation and stuff. But we need to be that role or have that mindset to be a patient advocate. So
right.
Right. And then go ahead.
So it seems as if you're moving into one of the questions that I wanted to ask as we get close to wrapping up. So what are the possible roles that after you graduate as with a doctorate in clinical lab scientist, what roles could you fill? We have just a few minutes that we want to wrap up, and I want to make sure that the audience will get as much as they can from you while you're with us.
Roles that we can play. As Doctor of Clinical Lab Sciences, DCLS professionals, we are being framed to be an educator, advanced lab practitioner, and practice in management, learn about management skills. As medical lab scientists, we are trained in the sciences, but management, like I said, is a whole different world, and DCLS programs will help fill that gap, get into that role, because as we have all experienced as MLSs and medtechs, being in management is trial by fire, right? But you don't have to do that. But we have now an avenue for us to learn this. But for me, for myself, emphasizing the educator in me to be a patient advocate and be in, as an advocate for the lab and also for the patient, to be able to communicate with clinicians and also communicate with the patient. Because in my experience, we need to have that role. And also serving as a consultant for rural hospitals, serving as a consultant for doctors' clinics. In our current CLIA landscape, moderate complexity can be done by a high school graduate, right? But we need to have a professional that can serve as a consultant to retain the quality. I've always, harped on this message that whether it's a big reference lab like Quest Diagnostics or LabCorp or ARUP versus a doctor's clinic, we're all following the same CLIA law, the same checklist, because we want to retain across-the-board quality. And the only way we could do that, even, we can't change CLIA, our law right now. And, but we as lab professionals can be there to provide the quality results. Because at the end of the day, it's all about the patient, the results that we're giving out. We are public health advocates. I've always, as an educator, I always tell my students, we may be working in the lab, but the slide that you push into that microscope is someone's mom, is someone's sister. I always, treat my slide like maybe that's my sister's blood. I would do it, like what we are taught in quality. Do it as if do the best you can, even if no one is watching, right? But yeah, that's a gap that I feel that a DCLS could fill, is as a consultant for hospitals, for rural hospitals, for doctors' clinics, to emphasize quality or to retain the quality in results.
Sounds great. So would you recommend this program to like a MLS looking for a next step in their career, and is there anything that you'd caution them about if they're moving towards this step?
This program, this is an advanced practice in the profession. So if you are as passionate like me in the medical lab, I advise you to, pursue this degree. My advice is, be prepared for coursework like you are a full-time undergrad again, because understandably people have to work and, go to school, but, you have to find that passion in you to be able to devote time to studying in order for you to be successful. Find a program of study that will match your goals. Talk to a program director and see if it matches your goals. Do your own research through our professional organizations. Talk to current students. Listen to current students that are in the program, or talk to the program director. And this is new to our profession, but this will, put us in the forefront of healthcare. We've always been in the shadows, working in the basement, but now this is an opportunity for us to be there, to be the face of a lab result, to advocate for our profession.
Sounds great. Sound exciting. Sound like something exciting to look forward to.
Absolutely.
Yep. So what's next for you after graduation, or personally and professionally?
That's still down the road, but I'm hopeful that to make a difference with this degree. Personally, I'm devoting to studying and working. Hopefully, the pandemic is over soon. But this program of study is what I'm trying to devote as a full-time student. I'm devoting my time to this. But professionally, hopefully, after graduation, I could make a difference in the clinical lab. That's my goal. World domination, right?
Sounds great. So if the listeners wanted to get in touch with you, to ask questions, to just, follow you, support you in any next step, is there anywhere they could contact you or connect with you?
Yeah, you guys can look me up on LinkedIn, Carlo Ledesma, and add me and send me a message. We can collaborate, talk about the program, talk about my experience, and if there's anything I could help concerning lab profession or issues in lab, we can talk about it. Follow me on LinkedIn.
Wow. Thank you so much, Carlo, for taking time out of your busy schedule and give me the opportunity to interview you and get our listeners the opportunity to learn more about you and the doctorate in clinical lab science. So it was really a pleasure for me to have you as a guest.
Oh, it's my honor.
Thank you so much. And thank you, listening audience, for tuning in to another episode of Elaborate Topics. And you can always tune in every week on Tuesdays for another episode. And thank you for me being your host today, Lona Small, and our guest, Carlo Ledesma. And so you can always subscribe. Always leave your feedback on our website, which is Elaborate Topics at Direct Impact Broadcasting. And you can also send us email at elaboratetopics@directimpactbroadcasting.com. So join us next week for another amazing episode of Elaborate Topics. Thank you so much.
Thank you for tuning in to another episode of Elaborate Topics, where your hosts discussed relevant strategies for laboratory professionals. Please subscribe to this podcast on your favorite podcast platform and listen to us on directimpactbroadcasting.com. Stay tuned for another episode with information you can use to excel in your laboratory career.